All right, so we have about 2 minutes left. I just couldn't all fit it in the 15-minute video time that I had. So the last two things that we're going to talk about on this slide are the milia and acne. So milia, those are present at birth. If you look at the bottom picture, you can see these little white spots around the mouth of the baby. And so they're just caused by trapped skin flakes in the different epidermal layers. So it's common to have them. They almost look like little baby pimples. Those will go away generally by the third week. It's just where we see some epidermal flakes within the layers of the outermost portion of the cutaneous membrane. So that's looking at baby and fetal development related things of the integumentary system. Generally, our integumentary system is pretty boring until we get to puberty. During puberty, if you remember, we have an increase in the activity of sebaceous glands, and that's why acne can appear generally at the start of adolescence. It's just with an increase of sebum, you can have an increase in the inflammation or bacteria that might linger in those sebaceous gland ducts, and therefore you can get swelling of those sebaceous gland ducts, which causes the acne. Even though we have acne when we're young, right, our skin is really thick, it's resilient, it's well hydrated, has lots of elastic fibers, and it's well hydrated because if you remember we said the collagen fibers are really strong, but it also attracts water. However, as we age, skin naturally loses elasticity and it thins. So external radiation, any external chemicals, anything like that can destroy the protein fibers that we have in our skin. Our fibroblasts just naturally decrease in activity, as do many different cell types in our body as we age. So you're not getting quick repair of any damage to elastic and collagen fibers. We know that as we age, those three types of skin cancer become an ever-increasing threat to the outer layers of our body. Skin cancer, obviously you can inherit mutations of those proto-oncogenes or those tumor suppressor genes. However, exposure to carcinogens also increases your rate of those skin cancers. And the older you are, the more carcinogens you've been exposed to over the timeline of your life. Therefore, skin cancer can become a problem as one ages. And then the last thing, the growth pattern of hair decreases as we age. The productivity of melanocytes decreases as we age. So that's why balding and graying can become a problematic also with an increase in age. So while age is definitely a contributing factor to balding and graying, there's other things that can influence how early one balds or one grays. So a lot of it is genetically determined. If you have family that had early balding or early graying, you probably have an increase of a decrease in activity earlier than maybe others of our hair follicles or our melanocytes. But drugs and emotional stress can also impact the activity of those melanocytes and also how well the hair is going to regenerate within the hair follicle. So that is it. You have all the content that would be on our test on Friday. Again, it's going to be all multiple choice. So happy studying and bring in any questions that you have pertaining to the test, and we meet next in class.